Good afternoon. My name is Betsy Bullard, and I'm going to be representing two people today because our SHIBA representative was unable to come. And I apologize if I'm sucking on a cough drop because I've had the crud that's been going around. But I'm well over it, but it's just kind of sticking with me. How many of you have had any connection with SHIBA? Do you know what it is? If you know it, just give me an idea. Possibly you don't. Okay. She often, when Heather comes, she says she is the queen of SHIBA. And that may help you to remember it, but it is a program, part of a nationwide network of state health insurance benefits advisors. And so in the information here, it kind of tells you what they do. Basically, they are the Medicare experts. So if you have any question about Medicare and prescription drug plans, Medicare Advantage plans, any kind of insurance question, Medigap questions, long-term care insurance, they are the experts to go to and get those questions answered. Also, if you have billing questions, or you want to figure out how VA benefits relate to Medicare. And she asked me to mention a few things specifically for the veterans today. She did say that you may be, as a veteran, eligible for Medicare savings programs and or low-income assistance. And that provides support for paying for your, for example, your Part B insurance premiums. That $96.40 or $110 or $115, whichever year you join, can be paid for through that program. So it gives you an extra $110 that you can spend on extra care or whatever is needed. Also, TRICARE, you must have Part B. No need for Part D, which is the prescription drug plan, unless you are eligible for that extra help. And then that's very helpful to have that. Medicare supplement, Medicare Advantage plan. There is no dental through Medicare either. There's no dental through TRICARE. But that retirement insurance program, you must have your Part B for that. However, if you don't have it, your VA health services, that does not count as credible coverage. So make sure that you understand that. If you're not going to get your health care insurance from Medicare, your VA benefits through the hospital will not be credible coverage. However, your drug portion is credible. The VA will not pay for Medicare health deductibles or co-pays, and you also can choose to decline that Part B if you've got your health insurance through the VA. However, if you then choose to go back for it, you can only go back during general enrollment periods, which is January through March, and you would be charged the penalty for it. So just remember, Part B, that Medicare, you might seriously consider it in addition to your VA hospital coverage. The other thing to think about is, will you always be near where there is a facility such as there is at Spokane? Will you always have the quality of, or will you always qualify for those benefits? And so she's really asking you to consider these things when you're looking at it. And will you always be willing to travel for certain VA services? So I will be able to answer perhaps a few questions about the Medicare Medicaid issue. We contract with them and help them out as well. But if you do have some questions, I can give you her information, and it is also on this information sheet that you received today. Now I'd like to represent myself and the Area Agency on Aging. The Area Agency is a place that we often find that people start the Area Agency when they don't have an idea where else to go. Now, if you've been through the hospital, you have an entrance into the healthcare highway. If you've been into a nursing home or had some home health care, you're kind of hooked into the information system of healthcare. But if you haven't, then we are a very good place to begin, because our goal as an agency is to work in partnership with seniors, with their caregivers, to enhance their quality of life and help them stay independent as long as they prefer to and are able to. In order to do that, we provide a variety of services. Our first and foremost, and what I represent, I shouldn't say foremost, but that's what I represent, is the information services and options counseling. Your first contact with our agency can be for information, and we often get that question from children of elderly parents. I was home at Christmas and I didn't realize how bad my mom's dementia was getting, and I really don't know where to start. What do I do? We try to look at what the needs are, what the support systems are, what the resources are that might particularly help you or help that person in helping a parent, for example, and get in touch with those to get the correct services. In some cases, the correct services might be a home-delivered meal because that person can't get out of their home. They've had an accident. They can't, their dementia is so bad that they really can't leave the home. They wouldn't even know how to prepare a nutritious meal. We can get them home-delivered meals immediately, practically, through our contract with the senior centers throughout the northern 5 counties. Also, we have home services that we contract with, as Connie mentioned. Some of the agencies, ours are non-medical home services, but it can provide that additional help cleaning the bathroom once a week so that mom can feel comfortable living in that home and continue to do so independently. We have a case manager that will go out and visit all of our clients and help them determine what their services are needed for them, what would help them, what kind of supports would give them that additional independence. And then we also have, if there is some concern about someone taking advantage of a vulnerable adult, vulnerable by virtue of their physical or mental capacity, we have an adult protection department in the area agency that does investigate those kinds of issues. So be aware of that as well. We also have an ombudsman program. If one of your loved ones is in one of the facilities, such as the nursing home or assisted living, or a certified family home, which is a small assisted living facility run by usually an individual in their own home. In the case of the assisted living and nursing home facility, our ombudsman can go and talk with the client, talk with the family, and make sure that the rights are being upheld, that the issues are being resolved, and kind of act as a mediator in those cases. So that is our information about our agency. We are in all 5 counties, northern counties, and we have resources available that we can direct you to in those 5 counties so that you can help remain independent. If you have questions afterwards, I will be available. I also want to encourage you, if you haven't already done so, to put information together in a file about who your children are, where they are, who your doctor is, who your lawyer is, where's safe deposit box, so that should something happen, you're unable to communicate your wishes, you will have this in a handy place. You can put your living will in there as well, so it is always handy. And I believe, is the living will in our packets today, Connie?
No, they've got it in the back.
Okay, there are packets, living will packets. We encourage everyone to have one of those, so that if you are unable, or your loved one is unable to communicate their desires, this can be written down, and an agent, medical agent, or I'm sorry, a family agent, a friend agent, someone can act on those medical decisions if you're unable to. Next we have Daryl Heisey, who is with the Veteran Service